I'm really honored to be here today, and especially it being October. October is the month of Pregnancy and Infant Awareness Month. And I'm very grateful. So, thank you to Ren Society. And just with my story dates back, I would say, about 10 years ago. So, it's taken me 10 years. It's only taken me about a year and a half ago to finally have the courage to actually talk about my journey. My journey, what happened to me, my grieving and my healing. So that's what I'm going to talk to you about today. And, there are things that are touching and are things that are sensitive, but I find that I've come to the point of accepting what happened. And I'm so honored now that I'm able to assist other families and women that go through a loss of a child, of an infant, a miscarriage, and I'm able to be a voice and a support system for them. So my journey began in July of 2007. So at the time I already had a son. He was about 4 years old, and I was able to, get pregnant. I was so excited because my first pregnancy was wonderful. I didn't have any issues. I was young. And, I never thought about miscarriages because I really never knew anyone that went through a miscarriage. And when, I was pregnant with my second baby, I was very sick. So during my trimester, so it's usually the first three months are the hardest. A lot of times people, won't tell you, won't share the news if they're pregnant. They usually wait until after the 3 months just to make sure that, the pregnancy is viable. There are no issues, and you become more comfortable because you're starting to show. You can feel, little jolts here and there, very like very butterflies kind of kicks. But and in all of it, really, it was something that I never expected. So I went in for a regular routine checkup at 20 weeks at the hospital with a radiologist. And, it's the first ten minutes, the radiologist is there. It's just you and the radiologist. And, your partner stays and waits in the waiting room. And once, I guess, all the measurements and all the necessary things are done, they call your partner in. So for myself, I went in there alone, and I'm lying there, and I can see that he's doing what he's doing. I can see the screen, and I can see I can see what's going on, and but I'm not sure what I'm looking at really. I'm just staring into a black screen with white lines. That's all what I'm seeing. So he's really quiet, which starts to kind of get me a little worried because now we're sitting there. It's been 10 minutes, and he's just really quiet and he keeps going back and forth with the little cursor. And I'm thinking in my head, like, what's going on? So I finally said to him, "Is everything okay?" He goes, "Just 1 minute, please." I'm like, "Okay." And, he then came back and told me that I had to go to labor and delivery and talk to a doctor. So I thought right then and there, something's wrong. Okay. So I thought, to be honest, what I was thinking was that possibly they found something that, my baby had some issue, it could be fixed, and away we go. Because, I have a baby already. I've already, I know I can carry, I could have a pregnancy, I can carry a baby full term, so there's no issue. And it wasn't until I got up there that I was told by the doctor, my husband was there, my brother came, and the nurse that, you know, the pregnancy is not viable. There was no heartbeat. So I was kind of like in a little state of shock, to be honest. During that time, I couldn't believe what she was saying. I'm thinking, well, you know what? We need to go for another ultrasound. There is no way that my baby's heart, there's no heartbeat. Like, I'm thinking the medical team is wrong. Like, here I am. I have no healthcare, you know, experience. I'm not a professional in healthcare. And there I am doubting them and the medical equipment that exists, right? And I was just in denial. And so I accepted it. I think I was more accepting it because I was in shock. I left the hospital. I went to my sister-in-law's baby shower. So my mom thought I was just crazy, that I was just told that I lost a baby. There's no heartbeat. The baby's inside of me still. And I'm going to a baby shower. But I think I personally went there, I think because I was still happy for her, but I went there to prove a point to myself. And I think it was that I can do this. And I don't know why I was feeling that way, but I went. And it was the worst thing that I could have done for myself, because after I left, I was just crying and I didn't know what to do. My OB obstetrician called me that week, that Monday morning, and I had to go see him. They were going to do another ultrasound in his office and see whether they can detect a heartbeat. Now, just to backpedal here, about a week ago, prior to me finding out about my loss, I heard my baby's heartbeat. So I thought it sounded normal. You know, I couldn't believe it. So when I went to see my doctor, my obstetrician, that following Monday, he told me that I have some options, but the best way is to go through the ultrasound, make sure that there's, confirm that there is definitely no heartbeat, which they confirmed that there wasn't. So it finally kicked in that I have a dead body, a dead baby inside of me. That's exactly how I felt. And those were the words and what I kept thinking. And now I'm thinking, well, what are we going to do now? I've never gone through, I never had surgery, didn't know what to expect. I'm thinking, well, how are we going to get this out? I know that when you deliver a baby, you have contractions, the baby comes, right? You go either through a C-section or a vaginal delivery. So I was like, okay, well, how does this work now that the baby's not alive? So I ended up having to deliver the baby, a vaginal delivery. It was through contractions. So they did induce me where I did feel contractions. So if we have any mothers on here, I went through the exact same motion as if I was delivering a baby with a heartbeat that was beating. And I think the hardest part was going through something like of the unknown. Sometimes I wish that there was a book, what to expect after a miscarriage, or, more support. When I went through my loss, I didn't have there was no resources that I had. There was nowhere that I felt that I could go. My doctors, my OB never told me, how can I seek help after this? Because once I delivered, I had the opportunity to see my daughter. So it was a baby girl, and I was proud to have met her, and I got to see, out of grief and out of such a, a heart, like a scary moment in my life, I was also able to witness life and the aspect of how we become from a tiny dot into an actual, a human, a full-grown human. But at my stage, my daughter was 21 weeks, so we were almost 6 months, and I was able to see her. She had everything that you and I would have. So from a bladder to her nipples on her chest, to her ears, her fingers, she had everything. And the only difference was that she was, was translucent, because she was in amniotic fluid for so long that, her skin is not like, almost like, when you look at a baby, you see her skin, it's just, you just see their skin there. With her, it was more like a gel-like form. But I was so happy that I was able, when I look back at it, I'm very honored that I was able to witness a stage in life that not many of us are able to witness. And I think I've grown from that experience that I've had. And I never knew why I went through this. Like, why me? That's all I kept thinking about. Everyone else is having babies, but why am I the one that's going through this? Like, why did this happen to me? I never really knew my whys, but I'll get back into, I think I finally figured it out after over 10 years. I finally realized what my why was. But going back to after I delivered, the hardest part for me was coming home. Now, remember, I had a living son when I went through this loss. So for me, it was when you leave labor and delivery, you leave with a stroller, with a carrier, and your baby is there. I was leaving empty-handed, holding my husband's hand. And I remember when it finally kicked in, was when I had to leave the hospital, the ward. I cried from the minute I left the hallway in labor and delivery, all the way into I went into the car. Now you have to remember, as I'm in the hospital, I'm in the same area that other women are giving birth. I can hear women, you can hear them in pain. I can hear babies that are born. I could hear all this. And at the same time, I just lost mine. So here we have other women that are celebrating while I'm grieving. So I had a lot of anger. I was really upset and had a lot of anger that why me? And that's all that I went through for a while, was why me? Because of my loss, I ended up suffering from post-traumatic stress disorder. I ended up having depression, so postpartum. And the one thing that I did do, and I had the strength in me that I didn't go on any medication. I felt that I could handle it. And what I remembered was my self-care. And I know a lot of these other amazing women, Jewel and Dr. Andrea Thompson talked about, was that self-care is so important. It helps us mentally, physically, and emotionally to heal. And we have to make sure that we're able to acknowledge when we're hurting. We have to make sure, in order for us not to burn out, is take that time every single day and to, whether it could be like an extra 5-10 minutes in the shower, going for a walk, having your favorite cup of tea, coffee, anything that makes you feel comfort. And that's what's helped me, was my self-care and talking about it. But the one thing that was difficult was that I wasn't able to talk about it because there seems to be some stigma that you only discuss when you give birth to a baby, a baby that is breathing, a baby that's alive. You're not supposed to talk about a miscarriage. You're not supposed to talk about, the loss, the negative aspects of pregnancy and loss. So that's, for me, was something that I held a lot of it in. I couldn't talk to a lot of, certain friends of mine never experienced it. Nobody would understand what I'm going through. I've heard some conversations where they didn't know what to say to me. So people avoided talking to me. So, I had a lot of hurt, but at the same time, I feel blessed now because I do have 4 beautiful children, and a lot of times I feel that sometimes it's a test. It tests our faith. It tests a lot, because after I went through my loss, I'm a Catholic, and I stopped going to church. I felt that if, I believe in my faith, that if this is what, why would God do this to me? Why was I chosen to go through a loss when I see other things happening? And why did he pick me to go through this and not why? So I had so many whys. And for years, I did not understand my whys. And I went into church one Sunday. We had a function for a family member. And as the priest was talking in his sermon, I felt that he was talking to me, because he was talking about people that went through life that had such a really, 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 like, something that happened to them so negatively that they leave their faith or they stop. And I felt at that day, it was like, wow, like this priest is talking to me. Like, I felt like there was nobody else in the church but me, because the words that were coming from him were things that's what I was thinking all along. So it was after that day that I actually found, wow, this has nothing to do with my faith. This has nothing to do with God. And he didn't do this to me. It's just something I had to learn to go through. There was a journey. There was a purpose for me in life. And I always wanted to know, what is my purpose? So it wasn't until about a year and a half ago, 2 years, that I finally found my purpose. And I was sitting with my coach, and we're going through a session, as I do pageantry as well. And, we're going through, what kind of a platform do I want for myself? And I'm thinking, literacy, I'm in education. I know how important literacy is, and just personal things with my children. Like, I think literacy is key. Why not literacy? And then I talked about my journey and what I went through with the loss of my daughter, and found out that my platform is pregnancy, infant, and awareness, because it's what I have gone through. I have experienced it, and I know exactly how women feel going through a loss, and I can resonate with them all. So that's my platform. So what I do now is, I did find out what happened to my daughter. She ended up having a cystic hygroma, which is a tumor on the side of her neck. So, and she had a heart defect. So even if she was born, I was told that she would have died shortly after birth. So I think that what happened was for the best for her and for myself. And today I'm able to educate women in the sense of self-care, bringing awareness to our society, to women, that, there is a forum that women can go through after a loss, that they can feel that they're they don't have to be afraid that they can't talk about it. There's like a sisterhood, there's a love for each one of us, knowing what we've gone through and how we can help and guide each one of us during your grieving process. And I've been able to go through my grieving facilitation with Sunnybrook Hospital for PALE support. And it's a wonderful, wonderful, wonderful place for women to join. They have Zoom calls, one-on-one phone support. And I believe there'll be a link as well in our chat. And there's a guide for women that go through miscarriage and loss before 20 weeks and after 20 weeks. So if there is any resources that you need. And I also find that there's not a lot of awareness. You go into the pharmacy, next time you're in Shoppers or Walmart, take a peek. They have brochures there. But a lot of times you will never find, I have still not found, a pregnancy and infant loss miscarriage booklets that women can just go into a pharmacy and pick it up. And that's what my journey. So for me, this is what my purpose was. My purpose of my loss was to witness the amazing experience of life before we hit a full term, 40 weeks, and the gift of being able to talk about it, share my story, because the more that I share my story, I'm healing as well. And that's what helped me to heal in the past. And I was able, through self-care, move on with my life. I'll never forget about my daughter and what happened to me, but I'll learn to cope with it in my life. And now today, I volunteer a lot of my time with Sunnybrook Hospital, and I help facilitate women that have gone through loss and their families. And it's the greatest gift that I think I can personally share, and just hear other people. And sometimes you just want them to be, people want to just be seen. They want to be heard, and they want you to just be present. There is no, you don't have to say anything. Sometimes it's just a listening ear. And if anyone has any questions, please feel free. I know some of the things are quite personal, but I'm so open to answering questions. It's been over 10 years, and I'm so grateful that I've finally been able to talk about it with all of you, and for other women that I deal with as well.
Nina says, what would you tell someone finding out the same news?
Take a deep breath and just breathe. What's going to happen is a mix of emotions. So as soon as you find out, there is, it's like a roller coaster ride, really. You have your highs and your lows. But the most important thing is to take care of yourself. Once you've got the news, listen to your healthcare team, and they have the best interest for you. But the most important thing is, once you've gone through this, is seek the extra support groups that exist, because you need, more than anything, you need that support.
Shioma asked you, how did you find the strength to try again?
You know what? I didn't want to give up. I still wanted to have a family, and that was the most important thing. Prior to my daughter losing her, I also lost 2 others. And I never had much luck with pregnancy, I found. With my firstborn, I did have an issue with the doctor, and I had some gauzes left in me. So they weren't found until 6 weeks after my postpartum checkup. So pregnancy was really tough, but my husband is so supportive, and I wanted a big family. I wanted to have that gathering at the table, and I wanted to have my kids. And I was just so determined that this is what I want, and nothing is going to stop me. And I'm just going to be determined, focused, take care of my body, self-care, and I'm going to let people hear my story.
We have a question. Was there someone that was your main source of support?
My husband. My husband is such a sweetheart, and we've been married for 21 years, and he was my rock. I know he was going through grieving, but his thing was that he wanted to make sure I was okay. And he was always, anytime I had to talk about her, he was there listening. And that's all that I ever wanted, was just someone to listen. My mom was really good. But coming from an Italian background, having a miscarriage is not seen in a positive way. And it's something that is very hush-hush. So it was really hard, because sometimes she'd be on the phone, she'd tell people and be, oh, Stephanie went through this. And it was always like, I didn't want anyone to feel sorry for me. I just wanted to be heard. I just wanted to express myself. And I felt I couldn't do that. But my husband and my mom were there for me, though. And I'm so grateful. And I think what also helped was I still had my son. Like my son was 4 years old. So I still had to be a mother. I still had to take care of him. Right. So I had to make sure that I had life still had to continue, but I was hurting. And it took a while, but I'm so thankful that I was able to get where I am today and help others. By talking about her and volunteering my time and my platform, I feel like I keep her legacy alive. And I did name her. Her name's Julia. In case anyone's wondering,